Hi, my name is Erica. I am one of your students, professor at Atzen, and this is my daughter Maria, who has agreed to volunteer for me. She is 19 years old, but Maria, will you please tell Professor that it's okay for me to do this?
It's okay for her to record me.
Perfect, I appreciate that. We're going to be doing a head-to-toe physical assessment. She's not here for any other reasons. There are no chief complaints of discomfort. We're just going to do a head-to-toe assessment, much like the physical assessment that we would do before you go to school. So, Maria, would you please tell me your full name and date of birth?
Maria Anderson, 7/23/1999.
Excellent. And today's date is?
December 14th, 2018.
Excellent. And who's our president?
Donald Trump.
Very good. I'm going to give you three things to remember, and as we go about, I'm going to come back to them, okay? Blue, dog, and purse. Okay? Want to repeat them?
Blue, dog, and purse.
Blue, dog, and purse. Excellent. So I'm going to take my pen light here, and I'd like to check your pupils, if I may. May I take your glasses?
Yes.
Thank you. So I'm looking to see if your pupils are equal and reactive to light. And we're going to check the left eye first. And it is beautiful. And the right eye, I'm going to put you at about a 7 to start. Good. And you went down to a 3 and you came right back up. I'm going to have you look at my fingers straight ahead, okay? And we're going to look up. And we're going to come back down. No, don't move your head. I want you to keep your head still. Just follow me with your eyes, okay?
Mm-hmm.
Up. Perfect. We're going to come up. Good. And down. And way over. And down. Now, can you see my finger okay? Mm-hmm. Excellent. Tell me when you can no longer see my finger. Keep looking.
Wait, am I looking straight ahead?
You're looking,
or?
your head is
Okay.
straight ahead, and I
Not
want
following
you to
it.
follow my finger with your eyes, okay?
Nope.
Okay, that's good. And then how about we're going to do the same thing over here?
Nope.
Perfect. Nicely done. I'm going to have you stick your tongue out at me. Oh, sorry.
Oh, wait, no, you have to text me.
I will be tapping your sinuses. Very good. Open up wide, say ah.
Ah.
Good job. If I had an otoscope, Maria, I would be looking in your ears. As it is, I don't have one. But on the left ear, I would look and we would have a cone of light at 7. And if I come over here to the right, I would see that we have a cone of light at 5. Her ears are equal. They're symmetrical. She's got some really pretty earrings going on today. Nicely done. Just going to feel for your lymph nodes to see if we have any swelling. I apologize that my hands are cold. And while I'm sneaking a feel in here, I'm also going to be able to feel a carotid pulse on the left and a carotid pulse on the right. And I don't feel any swelling at all in her upper lymph nodes, but I will sneak behind you eventually, and we're going to check for the thyroid as well. Okay? And we'll wait for that. Okay? So I'm going to have you put your arms straight out at me. Excellent. And push up. Excellent. Push down. Good. Hand grips. Now I want you to squeeze my fingers. There you go. Give them a squeeze. Perfect. Thank you. I'm going to check your strength tones down here on the left leg. So push against. Good. And against. Excellent. Now 2 legs out. 2 legs out. Pull back on the, yeah. And on the right. Excellent. Good job. I'm going to take and listen to your heart rate now. I'd like to listen to your heart tones. I do not have a bell versus a diaphragm stethoscope. I've got the cardiology Liftman. I can't hear out of anything but my cardiology Liftman, so I apologize for that. But I am going to listen to the 5 areas I am going to be touching right above your breast. It just breathes normal because I'm just listening to your heart tones right now. Excellent. I'm going to come right alongside your right breast. You're fine. And along your left. And I'm going to come underneath. Nice job. I'm going to listen to your heart rate, and my clock is on my phone. So let me get my stop clock. And breathe easy. So I'm only going to listen to your heart rate, okay? Very good. So I listened for a whole minute, and I have 92 heartbeats in a minute, and I also snuck in 11 breaths in that 1 minute.
Sneaky.
I know, I'm sneaky that way. So I got some really good lung tones right up here on the left anterior lobes. I'm just going to listen to your lungs in both sides. And how I was taught was to go from one side to the other. And doing that, I have a comparison. Instead of listening to one whole side at a time, I always zigzag across. I go from right to left or left to right, whichever way I start. I always go opposites.
Too.
So I'm going to take a listen. Nice big breath in and out. Beautiful. And again. Good. On the side. And over here. One more. Thank you. Going to come under your breast. And again. Perfect. On the back, okay, you're gonna turn around for me. Thank you. So some nice big breath in and out. And just take your time, okay? Good. Are you a smoker, Maria?
Nope.
Good.
Does it sound like I'm one?
What's that?
Does it sound like I'm one?
No, you're nice and clear.
I had some good productive coughs this morning.
Just 2 more. Actually, 3 more. Excellent. So your lung fields are clear both in the back and in the front. They sound beautiful. I'm going to have you turn around. If I had a thermometer, I would be checking your thermometer. However, as I search the house high and low, I cannot find our actual, nor can I find our old-fashioned mercury oral thermometer. So, unfortunately, I'm not going to be able to do that. I do, however, her skin tone is pink, warm, and dry. She is not diaphoretic. She is not warm or hot to the touch. Like I said, she is just a normal pink, warm, and dry. Her color is good. She's got, she still has a little bit of a summer tan on, but not too much. And on this side as well, she's got some old scars from previous injuries. Going to pull those back down for you, Maria. And if I were to take my fingers and give her a pinch, we've got a capillary refill of less than 3 seconds on both sides. If you would assist me, I would appreciate it by just holding that sphygmomanometer. There you go. So I'm just going to rest your arm. Just relax. Let it go. Just relax. We'll check your blood pressure here real quick. I imagine you've got a nice low blood pressure. I'm going to do it just one more time, make sure I heard correctly, okay? (98/62). Just hold still.
I'm doing well.
You're doing very good. Thank you. I appreciate it. All right, my dear. Let me put this off to the side here. And I am going to have you, actually, while you were turned around, if you could turn around for me just a minute. Now, nice and easy, I'm going to come up from behind you, and I'm going to feel for your thyroid gland. So I'm going to push, no, look straight ahead. Push off to the side and then swallow. That a girl. And then I'm going to push on this side and swallow. Excellent. And that feels good. Now I'm going to have you, if you don't mind, I'm going to have you lie down ever so gently. There we go. I'm going to leave everything covered, okay? And I'm just going to take a listen to your abdominal. Let me give you a pillow. There you go. So I'm just going to listen to your abdomen. I am going to start in the lower right quadrant. I'm going to be listening to you for a period of time, so bear with me, okay? All right, so right lower quad. And I'm listening for the quantity and the number of bell tones that I hear. And you've got some nice active bell tones. I was also taught to always listen to the abdomen before I were to do any palpation, because when you palpate, you could move some air bubbles around abnormally. So I'm just going to push on your pelvic bones first. Any pain in your pelvic bones at all? Or how about when I squeeze on your hips? No. Good. And then I'm going to just put some light pressure here in your abdomen. Any pain, discomfort at all as I come around the corner here? Am I tickling you? I don't mean to. I'm sorry. Any abdominal surgeries?
No.
No?
Not that I know of.
All right. I'm going to very gently, very carefully swing. No, it's going to give you a hand here. There we go. And you can slide down here to the edge. Perfect. How are you feeling? Good. Okay. Any questions as we go along? Not yet?
Nope.
All right. I also don't have a hammer, so we're going to improvise, and we're going to check our knee reflexes here with my trusty dusty stethoscope. And I want you to just loosen, nice and loose, okay? Just let her swing, okay? And I got to hit the right spot here, apparently. I'm not hitting it. There we go. Got it. Yep, found it. Good job. We also have reflexes back here, so I'm just relax. Just relax. Don't. See, this is what we do. We do this. Right. There it is. And you can feel that move. Just relax. Just let me. There you go. There you go. Good job. Good job. All right. I am next going to have you. I'm going to go ahead and have you stand down. Nice and easy. Perfect. And as I stand over here, why don't you, I think we can come right here to the end. Oh, right there. Go ahead and turn around and walk towards me. And then turn around and walk back to the chair. Excellent. I'm going to do a Romberg test on you. So what I would like for you to do is just for you to stand normal, casual. I'm going to kind of tap you one side or another, and I just want to make sure that you can maintain your balance and you're not going to fall down. Excellent. Very good. Okay. You can have a seat. Is there any questions that you have for me at all? All right. Looks like I think we've covered everything. You know what? The only thing that I didn't do on you was the, I didn't check for your pulses here. I did check your carotids, but I didn't check for a radial. I did do your brachial because that's what I did your blood pressure on. You're fine, just relax. Okay.
They're hard to find.
And a brachial. Your femorals are easier to find. There it is right there. And then, no, the other thing that we used to do when you guys went to school for your check was squats. Can you do a squat for me? Okay. Very good. Any pain, discomfort?
No.
Okay, excellent. Well, I really appreciate your time. We have checked your neuros. What were those three things I asked you to remember?
Blue, dog, and purse.
Blue, dog, and purse it was. Good job. Way to go. So, we've checked your neuros. Mm-hmm. I've looked in your ears without an otoscope. I did not look up into your nares. I'm going to take a look up into your nares. Left is clean and clear. Right is clean and clear. Did we check the throat? Beautiful.
Oh, we did that. You made me say ah.
And I couldn't remember if I'd done that, to be quite honest with you.
We don't have the chart with us.
Right. There you go. I did, by the way, wash my hands right prior to we started this assessment, and now that the assessment is over, I'm going to wash my hands again. And Maria, I thank you very much for your time. Yay! Thank you.